Hi, I'm Dr. Paul Lynch, and welcome to The Pain Show. Today, The Pain Show has gone on the road, and we're filming from Lubbock, Texas. We're here today with Dr. Alan Burton at the Texas Tech Health Pain Symposium's 27th Annual Pain Management Conference. And Dr. Burton, we'd like to really thank you for coming on the show today.
Happy to be here with you, Paul.
Thanks a lot. Dr. Burton, we're very honored to have him on our show. He's the president of the Texas Pain Society, and he's also a professor of pain management and anesthesiology at MD Anderson. MD Anderson is well known throughout the world for its treatment of cancer pain. And today we're going to talk a little bit about cancer pain. We have a lot of patients that come to see us at our practice with cancer pain, and this is a rare opportunity for us to be able to kind of pick your brain a little bit and talk to you a little bit about your experiences. Dr. Burton, could you just tell us a little bit about your practice at MD Anderson and the type of pain you practice? At the University of Texas MD Anderson Cancer Center, we're the world's largest cancer center. We have a very well-established pain program there. The pain department and pain clinic there treats around 10,000 patients a year that come through with cancer pain. Wow. Now, the oncologist, as you know, will take care of many folks that have cancer pain, but those that have a more resistant pain or pain that doesn't respond to just simple medications, they will refer them on to our clinic where we'll help them with other more advanced procedures or other different combinations of therapies. Okay. What's been the most challenging part about treating cancer pain for you? Well, there are many aspects about treating cancer pain that are a little bit unique and perhaps distinct from treating chronic pain syndromes. The one most obvious one is that the patient has cancer, obviously, and that itself can bring a lot of compelling issues to the forefront. The patient sometimes is facing a life-threatening illness. There are many social issues around that. The patient's under a great bit of stress, and sometimes adding a painful symptom on top of that amount of stress that they're going through can just compound the difficulty that they have in getting through their treatments. You know, it sounds very challenging, but it must be really rewarding for you also, being able to help the people that are really suffering. Sure, I think it's in the old days we used to think about cancer pain as just pain at the end of life, with the patient dying of cancer. But we've begun to look at this a little bit more scientifically and reframe the question a little bit. And there's a lot of ways that cancer causes pain. First is many times patients present with pain. They have pain that caused them to get diagnosed with cancer. They develop a pain that doesn't get better, and this leads to the diagnosis of cancer. So that's one type of pain. Then when they get diagnosed, they generally have some sort of resective surgery, like taking a lung out or taking a part of the body out, or either a biopsy or actually resecting the tumor. Those kind of surgeries can be very painful, so there's an opportunity there to treat that pain quite well and quite adequately, so that they heal up properly and go on to deal with the rest of the experience. Then the treatments of cancer, including radiation or chemotherapy or more surgery, themselves can all cause different types of pain. And many times we can be involved in that to help the patient get through that with as little discomfort as possible, so that they're able to complete all the treatments they need to get through to hopefully eradicate the cancer. And then the last way, which is kind of almost the old school, what we thought of as cancer pain, are those folks where the cancer is incurable or where the cancer comes back or metastasizes. And then in those cases, there are different approaches that we use many times to help those patients deal with that type of pain. So in each of those segments, or each of those sort of areas of cancer, there's opportunities for us as pain management specialists to help the patient get through that experience with less discomfort. You know, one question that a lot of my patients ask me about is they've heard about intrathecal pump therapy for cancer pain. Can you talk to us a little bit about if that's a good option for patients and when they should look at that? Yeah, we're advocates of this type of therapy. The therapy that Dr. Lynch is referring to is a pain pump that's actually implanted under the skin with a small catheter leading into the spine. And generally there are two types of patients that we think about this therapy. And one are the patients who are just having too many medication-related side effects. They're started on a little bit of medication by the oncologist, but they're just knocked out. So, the patient takes a pill, but they're asleep for 3 hours every time they take the pain pill. So these patients oftentimes
sometimes are forced into this very unfortunate situation where they feel like they have to choose between either being too sedated or too drowsy and sluggish and sleepy or in pain. And that's a very bad, difficult choice for patients to have to make. So this is one bucket of patients that does very, very well with a pain pump. We implant a small device. The patient gets a very low dose of medication into the spinal cord, and with a very small amount of medication, the patient gets really good pain relief. So this is a really nice therapy for that group of patients. The second group are the group that's been treated very aggressively with lots of medications, and the oncologists, the palliative specialists, the pain doctors have been hitting them with lots of generally opioid medications, but also other so-called adjuvant medications in very aggressive fashion, sometimes even on IV medications in a hospital or even in a home setting. And in spite of having large doses of medication, the patient's still having an awful lot of pain. So sometimes we're able to capture that pain also with this type of pump.
The whole reason I went into pain management is because my mother-in-law, she had cancer, and I didn't even know I wanted to be a pain doc at that time, but as I started researching treatment options and trying to find solutions for her, I decided this is what I wanted to do. One of the things that was frustrating for me at that time is I didn't feel like I knew where to go for solutions. And I just wonder, from your perspective, having seen a lot of patients go through cancer pain, what would you recommend if you're suffering with cancer pain? How would you go about seeking out the right treatment?
Right. Well, that's an excellent question, Paul. And this answer is very nuanced. It depends in what community you live in, and certainly whether you live in a big city or being treated at a large cancer hospital or out in a small community with a local oncologist. It's very setting specific. The first stopping point for all patients would be with their oncologist, and just to bring it up either with their oncologist or sometimes their primary care physician. I'm having an awful lot of pain. And sometimes this is not obvious, and it's not talked about very much. So the patient really needs to bring up that symptom and discuss it with their caregiver, usually their oncologist or their primary care doctor, and start with a referral pathway from there.
I love that you brought up just being vocal, because so often I see patients who are suffering with cancer pain and they just don't tell their doctor, and they just assume that this is just part of the process, when in reality, if they just discuss it with their doctor, there are options out there. The question I have is, the other thing we see is just the patient is told over and over that the answer is opioids, morphine, or fentanyl, or just more medications. When does the patient know that it's time to seek other options, and what are some of the things that you can do for them?
Sure. I think that's a really, really good point, because many patients have become a little bit more vocal. There are advocacy groups, and sometimes the patient's family has to advocate for them in the cancer setting. So when those patients feel like the answer that they get is always take more morphine, more methadone, higher doses, and the family says, you know, but mom is out of it. She's really a zombie, and you're telling us to give her more medications. Sometimes that's very frustrating for the families. In those cases, I think it's really important to have a good talk with the oncologist about a referral to a thoughtful pain specialist that can approach the problem very systematically and look at things, for example, as diverse as orthopedic surgery for an impending fracture of the hip, perhaps a cement injection into a fractured vertebral body or into a long bone that has a metastatic lesion. There are tumor ablative procedures that can be done with interventional radiology. There are also a variety of nerve blocks we can do with radiofrequency or cryoprobes to cut down on pain focally in the body and obviate the need for some of the high-dose systemic medicines that can cause so many of the troublesome side effects that people are faced with. So I think it's a very, very valuable discussion when the patient's family or the patient feels that they're having too many medication-related side effects.
Dr. Burton, we really appreciate you coming on the show today. Some of the answers you've given us and just the way you're approaching your patient, we're really happy that we have options out there like yourself and your practice and what you're doing, and we know there's a lot of suffering involved with cancer, and so we really appreciate what you're doing for your patients and also for you coming on the show today.
Thank you. It's a pleasure to be on the Pain Show.
Yeah, thank you. That's our show for today, folks. If you want to learn more about cancer pain or some of the other procedures we talked about today, we talked about intrathecal pump therapy, we talked about vertebroplasty and ablative procedures, go to paindoctor.com and you can read more about cancer pain and the procedures to treat it. And also, if you'd like to know more about Dr. Burton, you can just search for Alan Burton, and you can read a little bit about his practice and how he helps people at the MD Anderson Cancer Center. Thanks a lot for joining us for today's episode of The Pain Show. Remember, at The Pain Show, we believe you can be pain-free.